my name is Lacey Schooley, and today I'll be demonstrating how to place an NG tube, remove an NG tube, and also how to document on an I&O report. So the first thing I'm going to do is check over my healthcare provider's orders. So this is for Dr. Leo's patient, Shirley Coast, 5/14/1964, and it is for the insertion of an NG tube for gastric decompression due to her small bowel obstruction, and then also an x-ray of the abdomen after the NG insertion to make sure it's in the right location. And then once we have verified that it is in the right spot, we are going to attach it to low intermittent suction. So now that I'm done with that, I can enter the patient's room, perform hand hygiene. Hi, my name is Lacey. I'm going to be your student nurse today. How are you doing? Good. Can I just have you verify your name and date of birth for me? Shirley Coast, 5/14/1964. Shirley Coast, 5/14/1964. Perfect. So Dr. Leo has put in an order to put an NG tube in. So that's just a small tube that's going to go through your nose and down to your stomach, and it's just going to suction out some of those contents to help with your small bowel obstruction, okay? Do you have any questions? No? Okay, so I'm just going to raise you up. So the first thing I'm going to do, Shirley, is listen to your stomach for your bowel sounds, okay? Okay. So I'm just going to raise up your gown a little bit to expose your stomach. Okay. So the bowel sounds are hypoactive in all 4 quadrants. And then Shirley, how would you rate your pain right now on a scale from 0 to 10, 0 being no pain and 10 being the worst pain? About a 7? Okay, and how would you describe that? Kind of bloating and discomfort? Okay, well hopefully this NG tube should help with that, okay? Okay. So the first thing I'm going to do is just measure it and get kind of a rough idea of how far I need to place the tube in, okay? Okay, so I'm going to go from the tip of your nose to your ear to your xiphoid process. And then I'm just going to mark that. Perfect. Okay. Okay. So I'm just going to place a towel over you in case there's any leaking of the fluids. And then here's a basin, just in case you feel any nausea and feel like you need to throw up. It's perfectly normal, okay? And then here's a glass of water. So when we're putting the tube in, I'm just gonna have you drink water, and then every time you swallow, I'm just gonna push the tube down a little more, which should help with the discomfort, okay? Okay. So during this procedure, Shirley, you're not going to be able to talk. So we're going to have some hand signals that help you communicate with me, okay? So if you give me a thumbs up, I'm going to keep going. And for any reason, if you just need a break, if you feel any dizziness, shortness of breath or anything, hold your hand up like this and I will stop right away, okay? Okay. So we're going to go ahead and start placing this tube, okay? Okay. So I'm just going to take the pillow off from under your head. So I'm going to first put this in. I need you to hold your head back, okay? Okay. And the patient is gagged, so I'm going to pull it out about 1/8 of an inch. And now I need you to flex your head, so put your chin to your chest, okay? And then just every time you take a drink of water, I'm just going to slowly push the tube in, okay? Okay, so swallow, swallow, swallow. Okay. So I've met a point of resistance, so I'm going to go ahead and put this adhesive on your skin. I'm just going to clean it first, just to get any oils off of the surface, just so it sticks, okay? Okay, so now that that's dry, go ahead and place that. This is just going to hold it in place while the tube is in, just so that it doesn't move and cause you any more discomfort than it has to, okay? Okay. Perfect, Shirley. So the next thing I'm going to do is just check the pH. That's just my first check to make sure it's in the right spot, okay? Okay. So I'm just going to draw out some of your gastric contents. Put that plug back in. Okay. My pH strip. Dip it in. Comparing it to this, it's about a 4, and I know that's good. If it's 1 through 4, I'm in the right area. Okay, Shirley, so since that's in the right spot, I'm going to go ahead and just wrap some tape around the tube and secure it to your gown. That way if you get up or move around, it just kind of stabilizes the tube a little more. That way we can prevent some discomfort for you, okay? Okay. Perfect. Just clean my area up for you. Place the pillow back under your head. Okay, Shirley. Do you need anything else? Are you good? Okay, so now what I'm going to do is I'm going to call for x-ray to come, radiology, and get an x-ray just to double check and verify that that tube is in the correct spot before I hook it up to suction, okay? Okay, so I'm going to notify radiology to come get the x-ray that we're ready. I'm going to document the time of the procedure, how the patient took the procedure, and then I will come back after the x-ray has been done. So the x-ray is done, the tube is in the right place, so I'm going to go back into Shirley's room. Hi Shirley, how are you? Good. Okay. So since I left the room while the x-ray was getting done, I'm going to re-verify the patient. Shirley, can I verify your name and date of birth for me again? Okay, Shirley Coase, 5/14/1964. Shirley Coase, 5/14/1964. Perfect. Okay. So the x-ray was done and it shows that the tube is in the correct location. So I'm going to go ahead and get it hooked up to suction, okay? So we'll hook it back up to suction. We'll put on low intermediate suction until the doctor orders the tube to be removed. When that time comes, we will check and document the level of fluid that has come out, the color, the consistency. So we'll also dispose of that in the biohazard. So, okay, Shirley, so the doctors ordered the removal of that NG tube, okay? Okay. So we're just gonna do that. So I'm just gonna start by unhooking it from your gown, okay? Okay. Just that way when I take it out, I'm just gonna place this towel back over your chest. And so I've unhooked it from suction. And I'm gonna take a syringe. And I'm gonna just put 10 milliliters of air just to push anything that might still be in the tube. So now that that's done, you can go ahead and remove the tube, okay, Shirley? So I'm just gonna unhook it. First, I'm gonna put gloves on. Okay, so Shirley, this shouldn't be as uncomfortable as when we put the tube in, okay? I'm just gonna unhook it, and then on the count of 3, I'm gonna pull it out. And I just need you to hold your breath as I do that, okay? Okay, so 1, 2, 3. Perfect. I'll dispose of that in a biohazard container, and I will get an alcohol swab just to clean the adhesive off Shirley's face. Okay, Shirley, we're just gonna take this off. So I'm gonna clean where the adhesive is, the nose, in case anything came out when I took that tube out. And then if Shirley would like, I also can perform oral care just to clean up her mouth. Shirley, did you need anything to drink? You want some water? Okay, there you go. Perfect. Okay, so now that the tube is removed, I'll document the contents, the time we removed it, how it went. Shirley, did you need anything else? No? Okay. So I'm going to make sure patient as well. Okay. And since she doesn't need anything else, I'm going to check her bowel sounds one last time just to make sure that the procedure works. So I'm just going to check your bowel sounds one last time before I leave, Shirley. Okay, so your bowel sounds are active, normal, so that is good. So she has her call light. So I'm going to come back in about 4 hours to check on you to make sure there's no nausea or vomiting, okay? But if you need anything before that, just hit your call light and I'll come back, okay? Perfect. And then also we have my I and O report.